Every day, all across the U.S., law enforcement officials face challenges that put not only their physical attributes to the test, but also their mental. And this conversation remains largely unspoken. Today, we're going to shed some light on that on the Grayson County Podcast. Welcome back to the podcast. I'm Lieutenant Jeremy Cox, and today with me is
Sergeant Amanda Owens.
And so April 1st ushered in Stress Awareness Month. And so we thought that we'd talk about stress management and awareness as it pertains to law enforcement in the U.S. So a little bit about that is in law enforcement, largely it goes unnoticed. And so, Amanda, law enforcement officers, they often encounter high stress situations, right? I mean, can you shed a little light on why mental health awareness is so crucial in this profession?
Certainly, Jeremy. Studies have shown that approximately 30% of first responders develop behavioral health conditions such as depression and PTSD, compared to 20% of the general population. This highlights the unique pressures that we face every day on duty and off, and the need for mental health awareness.
And so, to put that into a little perspective, you think about the law enforcement, public safety, first responder professional that you may run into on the daily basis, right? Now, when we think about that, you can put that into perspective of profession, right? Who are we talking about? So you're talking about the law enforcement professional who's out on the street answering calls for service, doing traffic stops and things like that, detectives. Then there's behind the scenes, more on the law enforcement side. You've got jailers, correctional officers. They deal with a tremendous amount of stress in their area of responsibility. And then, even farther behind the scenes and often relatively unseen, 911 communication dispatchers.
That's a big one.
That is a big one, right? And in my career path, that is a part of it, right? I was a 911 communication dispatcher for a little bit of time, and I tell you, the biggest thing that I found out of that was the lack of closure, right? You would get these calls, and people would be upset, they would be crying, they would be desperate for help, and you would get all their information, and you were trying to calm them down, and you were dispatching, emergency personnel, whether it's fire personnel or law enforcement personnel, and maybe even staying on the line with them for as long as you can, and then the call ends, right? And you don't really know what happened, right? And over time, those things kind of wear on you, right? And to hear that type of grief a lot of times on some of those calls too can just wear on you. So those individuals, and then fire personnel, right? I mentioned them too, right? Like whether it's fire, EMS, paramedics, having to deal with those types of situations that they're going into on a daily basis. They see so much pain and anguish, and so you think about that. We often don't, and then you see them at the grocery store. You see them at the checkout counter at a discount store, or you see them at the gas station pumping gas. And what you don't think about is perhaps, just maybe, they just came from a call where they've had to deliver the most devastating news ever to a family, or they've had to deal with someone who's been tragically injured, or
they had to take the call of, a traumatic event
exactly
from the community.
and now they're on to their next, right? They leave that call, but their day doesn't stop, right? The shift isn't over just because that bad thing happened. They still have the rest of the day to go, and so those law enforcement professionals, they get, I don't want to say real good at, but they get a little bit real good at compartmentalizing, right? Masking.
Yeah, that's a good one.
That is a good term, right? And that is a term for it, right? We mask, we bottle things up deep down, and the only problem is they don't go away.
Right. So you're very right. All first responders are exposed to traumatic events. For instance, a study found that firefighters and law enforcement officers are more likely to die by suicide than in the line of duty. And EMS clinicians are more likely to take their own lives than the members of the general public. This underscores the mental toll on our jobs can take.
Yeah, and there's a lot of professions out there that are more receptive to offering assistance, to allowing for, hey, you take a day off or something like that, you just go ahead. And not that we don't try in law enforcement. But I know in my career, that hasn't always been the case, and I know you've probably seen the same thing,
yes.
Right? But lately,
It's changing.
it's changing, and it's getting better,
Yes.
right? And I know some programs, lots of organizations are trying different things, right? I know here at the Sheriff's Office and here in Grayson County, we have a peer support program.
Yeah, I wanted to talk a little bit about that. Our peer support program consists of trained volunteers who offer confidential support to colleagues facing personal and professional challenges. The goal for that is to provide emotional and tangible support during times of need, helping to manage the stress and prevent more severe mental health issues.
And so this isn't like advice coming from some clinician and I'm not saying anything negative about those individuals at all, but these are people who have been in our shoes.
Right.
Right? They have most likely experienced the same things or similar things than someone who is struggling.
Right, and they'll be more receptive to the input that those people are giving.
Right. And this isn't like a Grayson County Sheriff's Office, we came up with it sort of thing, right? This is you might say peer reviewed, and I understand that even the International Association of Chiefs of Police, this is an initiative that they're pushing.
Yes.
So, has this program impacted any of our staff? And without getting into specifics, of course, because it is confidential, right? We're not gonna air anybody's laundry, of course, but have we seen some benefit from it?
Absolutely. The benefits for our agency specifically, it helps reduce the stigma around seeking help. It views it not as a weakness, but a strength, getting help for on and off duty mental health issues. It's about building resilience and enduring. Our team knows that they're not alone.
And it's funny you bring up, the strength to ask for help.
Yes.
Right? As law enforcement, Often we are called, and first responders in general, right? First responders in general. Often we are called upon to be strong for others.
Right.
Right? It doesn't matter which avenue you are in, whether you're in a big red truck, you wear a duty belt, you work inside of a correctional facility, or you wear a headset and answer the radio. Right? There are moments where you have to be strong for someone else. Get in a habit of that, right? You get really accustomed to it, and sometimes when you feel vulnerable, you feel weak, and you don't think that you should, and a lot of times when you think that, well, if I share that with someone else, if I tell someone that I'm struggling, if I tell someone that I'm hurting,
And it's going to show a weakness.
it's going to show weakness, and then maybe they'll think I can't do my job.
Right.
Right? And so, in saying that, we are trying to get better at normalizing that, at creating an environment, not just here at the Grayson County Sheriff's Office, but as a community of first responders, to normalize that, that it is okay.
It's okay to have those conversations.
Exactly.
We definitely need to normalize that and we need to provide the ongoing training and ensure the confidentiality. Leadership support is crucial in demonstrating this, and seeking help is a sign of strength, not weakness.
Absolutely, absolutely. And, a little cartoon the other day, and it was, what's the hardest thing you've ever had to do? And it was ask for help.
Yeah.
Right? Ask for help. So, you think, well, that this doesn't affect us here, right? This is Grayson County, or this is Texas, right? Recently Harris County suffered a tremendous loss, and so this is real, and so that's why the sheriff's office here has taken a very robust and positive effort moving forward to ensure that the mental health considerations for our staff members is at the forefront of our leadership staff, and that they know, our employees know that we care, and we care about them, and that they're not just a number, and when they are hurting, we want them to get the help that they need.
Yes.
So, well, Amanda, thank you for joining me today on the podcast. Thanks for jumping in with us here and joining me with Grayson County and discussing this topic. And I know it's a sensitive topic, but I appreciate your time and jumping in with me today.
No problem.
All right. So,
Pleasure.
one little final thought, Grayson County. If you are a first responder, or if you know a first responder, and they're struggling with depression, they're struggling with any type of mental health care issues, there is always help available. The International Association of Chiefs of Police have a peer support guidance program. And then also there's always the National Suicide Prevention Lifeline. So there is help. Please don't take yourself away from the ones that care about you. With that being said, thank you for joining us today. I know it was a heavy topic, but thank you for joining us today on the podcast. We'll see you here next Thursday at 9 a.m. Don't forget to like and subscribe, and stay safe, Grayson County.